Mr. Heng, all yours.
Okay, thank you very much, Chintong. Good afternoon, everybody. Inglaba, so my friend. Today's topic is a research that was featured in the lucidum polysaccharides that protects myocardium and reduce cardiotoxicity of chemotherapy drugs. All right. Okay, next one. Okay. Now, it's very sad that when one is diagnosed with cancer, and usually you'll be very shocked and you cannot accept it. But after the initial shock and acceptance, you have to go through the process the doctor has advised you. And the first thing that they do in cancer is resection. That means surgery to remove the cancer growth. Okay. Then after that, they will put you through radiation, burn up the part where there's cells. Then after that, they will inject chemotherapy to kill more cells around your area. Okay, that is the normal procedure that the doctor will do. Okay, when you go through cancer treatment. Right, the commonly used chemotherapy drug is doxorubicin, or in short, DOX. Commercially name is, okay, naturally, I mean, we all have to go through all this process if you are a cancer patient. The chemotherapy drug, but the side effect will go off, right? Once the chemotherapy drug is completed, okay, it will slowly come back. Maybe after it has completed, maybe 6 months to 9 months, you will start to heal and get better, and things will go back to normal. But damages to your heart muscle will never go back to normal. Okay, why? Because the regeneration of our heart muscle tissue is very, very, very slow. Okay, a healthy young man below 25 years of age, when he's still growing, he only has 1% of the heart muscle being regenerated. Okay, and you will as you grow older, this regeneration rate will keep on dropping. And worse, if you are sick, it probably goes to zero. But of course, there's no need to worry whether it's new or old. So long as it is there, it's functioning normal. There's no harm. Okay? Doesn't mean that new one is better, old one doesn't work. To the heart muscle, new or old, so long it's working, it's working. There's no need to worry. The only problem that it is not working. Okay? So why is it the heart muscle is important? Heart muscle cells is important because the heart do the pumping of the blood to carry oxygen and nutrients throughout the body. Right? So naturally, when your heart muscle is not working well, or heart muscle is weak, how is the heart going to pump? And when the heart is not able to pump, it's not able to carry oxygen, it's not able to carry nutrients to every part of your body. Right? Next one. So when that is the case, your the heart pumping action will be weak. Right? And when it's weak, how are you going to recover and fight against the cancer that one is suffering from? Right? So, I mean, in a sense, of course, you may say that, okay, I want to minimize the damages. But if the doctor want to minimize the damages, yes, he will minimize the damages done to the heart muscle. But it will not be effective to kill the cancer cells. So it becomes a wasted effort. The doctor wants to have sufficient dosage to kill the cancer cells, but yet have to ensure that you are safe. Correct? So that's why the researcher thinks that maybe supplement from as a supplement during the chemotherapy treatment may help. Okay, next one. Okay, this paper was done by the Chinese professor. His name is Xu Fan. He's from Chengde Medical University, Hefei. Okay, he found that polysaccharide extracts from the fruiting body of Ganoderma lucidum, which is also known as lingzi or reishi in Japanese, reduces cardiotoxicity caused by chemo drugs, doxorubicin. Okay, I mean, you know this polysaccharide extracts, lingzi has components like polysaccharides, terpenoid, all that. Okay, so we only look at the polysaccharide extracts. Okay, their paper titled Effects of Ganoderma lucidum polysaccharide against doxorubicin induced cardiotoxicity was published in the magazine Biomedicine and Pharmacotherapy in 2017. Okay, if you want to read on it yourself, maybe you can go to the PubMed and refer, type in the title, you'll get it. Right, next one. Right, we go into the study. Okay, the study was done in three parts. Okay, first they do an animal study. Then they do a cell study using the animal heart cells. Then after that, they also do a cell studies using cancer cells to see the various effects. Okay, they first separate out the animals, the mice, into 5 groups. One, the control group. The control group is of course normal, healthy mice that is not treated. Okay, just to be sure as a control, to make sure that there's no difference from those test subjects. Then the second one, they only fed these mice with Ganoderma lucidum polysaccharide. Why they do that is that in case there's any other side effects that they do not know, so they want to make sure that it's purely one group that is only purely Ganoderma lucidum. All right. Then they have another group that is purely only undergoing chemotherapy, just like normal cancer patient undergoing chemotherapy without any other supplements. Okay. Next one. Then the fourth group will be now they have it with doxorubicin plus Ganoderma, and the fourth group and fifth group is depending on dosage of Ganoderma polysaccharide. One is 50 milligram per kilo, and one is 100 milligram per kilo of Ganoderma polysaccharide. Right? So they, after 15 days of study, okay, after 15 days they will measure the blood serum of the mice. Measure things like the lactate dehydrogenase or LDH, tryptophan kinase or CK, and the aspartate aminotransferase AST of the test subjects. Okay, why they want to measure these 3 markers? Because these 3 enzymes are enzymes that's secreted by the heart muscle. You also can find such enzymes secreted by the normal muscle and liver and kidneys. Okay, so this enzyme, when the muscles, the heart muscle are injured, they will secrete such enzyme. The higher the damage, the higher the secretion. So they can use it as a measurement of the toxicity of the damages done to the muscle. Okay, next one. Now, so what did they find out? Okay, they find out that Ganoderma lucidum polysaccharide, okay, can significantly reduce the blood serum of LDH, CK, and AST of the test subject. Okay, they only I only be able to access one chart lah. As you can see, the control, which is the normal mice, no effect. The one with 100% Ganoderma polysaccharide is just like the control, no effect. When it comes to the chemo, the group that is injected with chemo on the first, third, and fifth day, you find that their LDH secretion level has shot up, right? Then, when they are mixed with, they have so-called added Ganoderma polysaccharide in their supplement for 50 milligram, the level drop lower. For 100 milligram, it goes even lower. So this goes to show that Ganoderma lucidum polysaccharide can reduce cardiotoxicity of this chemotherapy treatment. Okay, next one. Okay, that the in-vivo study has shown us that although the blood serum level is higher for the Ganoderma polysaccharide group than the normal group, okay, because of course you will still suffer some damages when they subject to chemo drug dox. There will be some damages, but at least if you have supplemented it with Ganoderma lucidum, the damages is much lower. Of course, it will be even better if the dosage is higher. That's why sometimes in our lesson we talk about higher dosage for cancer drug. Why? Because it can improve the situation. Okay. The study also did a historical images, right, of the heart muscle tissue, which I'm not able to extract to show you here. And this heart muscle tissue has shown reduced damages for the GLPS group than those that are not treated with GLPS. Okay? And at the same time, they find that the GLPS group, the Linkser group, the weight of their heart, I mean, after 15 days, they'll sacrifice the mice, then they cut it all out and measure it, right? Was closer to that of the normal group. Okay, this goes to show that there were no shrinkage or what the damages being done. Okay, so in a sense, it proved in this in vivo study that Ganoderma lucidum polysaccharide can protect heart muscle, right, from the cardiotoxicity caused by chemo drug, doxorubicin. Okay, right. Then we look at the next slides. Next slides. Okay. Next slides. Okay. Now this slide is, of course, that was just the first part of the study was just to look at the serum, the blood serum, and then they cannot see exactly what is working, right? So they have to do a study through the dish. So in vitro outside, right? They cultivate H9C2 cells. These H9C2 cells are heart muscle cells from the mice. Okay, they cultivate it for 8 hours with or without linzi, and they add doxorubicin in it. Okay, 16 hours later, they look at the survival rate of the cells, of the cardiomyocytes, all right, the heart muscle cells, and they count it, all right, based on, like, I think if I'm not wrong, it's based on PCR, huh? Then this shows that, the same result, okay, as per the in vitro, right? Linzi can significantly reduce the number of doxor-induced H9C2 cells there. And at the same time, the LDH release was also lower. So, in a sense, this outside the body experiment shows that it is the same result as the in vitro. Okay, they can see exactly more closer, right? Okay, next one, next slide. Right, this why they want to do this part of the study. Okay, now in the earlier two studies, they show that doxorubicin cause cardiotoxicity, and this linzi GLPS can reduce it. But what about the effect if, okay, next slide, I'll show you the graphic representation. Okay, as you can see, both have the same, more or less, pattern. If it is just control without anything, of course the survival rate is naturally 100%, right? But if it is with linzi, it will reduce a bit better. But once it is with chemo drug, the performance will be much lesser, right? As you can see, it gets better if you have added in linzi together. Okay, so the survival rate of the breast cancer cells and the liver cancer cells has improved. Okay, next one. Next slide, please. Now, further investigation, of course, they want to know what happened. What happened to how it caused about this chemo drug, how it caused damages and death to the heart cells. Okay, it caused death to the heart cell because these chemo drugs promote cell death, myocardial apoptosis, the heart cell dying itself. Okay, it encourages oxidative stress. You know, oxidative stress is one that create free radicals, and it create imbalance in the body, and as a result, the cells will die. And chemo drug at the same time decreases the activities of antioxidative enzyme, and it increases the production of pro-inflammatory cytokines. As you know, inflammation, although it heals the body, but at the same time it causes many other effects down the road, right? However, with this linzi pre-treatment, it shows that it can reduce the negative effect of Ganoderma of chemo, and result in reduced damages done to the heart muscle. Okay, next one. Okay, Now the study want to know what happened, how they go about to Lingzi or Ganoderma polysaccharide, how they go about to protect the heart muscle. Okay, so the study explore this transcription factor known as NRF2 that is present in every cells in our body. Okay, so they extract this NRF2, and this NRF2 is the one that regulates the antioxidant process in our body. All right. So when it is activated, it will set off the antioxidant defense mechanism, anti-inflammation, antioxidative stress. So called it will be a cell protection for our body. Okay, and the study found out that chemo drugs treatment reduces this NRF2 expression. Okay, and thus causes the cell not able to do its own protection, right? And naturally they die off lah. And of course, a following chain of event like antioxidative stress all that not able to protect itself. Okay, next one. So how Ganoderma lucidum polysaccharide was able to reduce the level of cardiomyocytes damages caused by this chemo drug and carry out its protective process. They found out that this Ganoderma lucidum polysaccharide is able to suppress a protein called curlin-3 in the cells. This curlin-3 inhibits, this curlin-3 if you inhibit by this Ganoderma polysaccharides by so-called restricting curlin-3 protein, then the NRF2 expression is able to stabilize. Because this curlin-3 is the one that is pressing down on the NRF2 expression, so-called inhibiting. So that means they are not able to do their own activity, right? So with polysaccharide or with Lingzi, they can suppress this curlin-3, so NRF2 is able to do its job, right? So when it's able to do its job, it's able to carry out its self-protecting function, reducing the apoptosis, oxidative stress, and inflammation. Okay, so when it's lesser inflammation, lesser oxidative stress, lesser cell body, lesser cell death, reducing apoptosis, cell death. Of course, the myocardium will have lesser damages. Okay, right. So, in conclusion, next slide, Sam. Next slide, Sam. In conclusion, right, the study show that Lingzi can reduce damages caused to the myocardium by chemotherapeutic drug, doxorubicin. Right, and at the same time, it enhances the toxicity of chemo drug. Right, we know that chemo drug is toxic. Right, it kills the cancer cell, but at the same time, Lingzi can enhance this toxicity to kill the cancer cell, so that more cancer cell will die. Right, and more cancer cell will die, naturally your survival rate will be better lah. Right. Now this study only used one chemo drug, doxorubicin. Right, but all other chemo drug naturally has the same cause. It also cause a kind of some degree of cardiotoxicity to the body, right? So supplementing your chemotherapy treatment during the chemotherapy treatment with 灵芝 is definitely to maximize the effect of the toxicity of the drugs, and at the same time minimize any potential ill effects, which is what we have been saying all the while, right? Okay, so that will be all that I have. Thank you very much. I hope my sharing you can have a better picture, so that next time you supplement when your friends or relatives who suffer from cancer and undergoing chemo treatment, recommend them to supplement it with 灵芝. It can help to protect and prolong life. Thank you.